Good morning. This is Dr. McDaniel at GYN Corner. I'm presenting all things health related for women. Thank you very much for joining me on this Facebook Live presentation. And also, if you're coming from the YouTube channel, it's also GYN Corner. Lastly, if you're coming from the podcast, we have podcasts now since this Monday of this week on Spotify and on Anchor. And since today, August 9th, we're now available on Apple iTunes. So please check out GYN Corner. Please press the like button, press the subscribe and follow button, and please post any questions you have or ideas for topics, issues that you'd like for me to address so that I'm bringing important information or valuable information that you want to hear and know about. Let's see. So yesterday I spoke about tubal pregnancies. Today I'll speak about ectopic. They're one and the same. Ectopic is a general term for pregnancies outside of the uterus, whereas the tubal is a specific term for pregnancy that's outside of the uterus and it's sitting in the fallopian tube. So yesterday I stated if you think of the uterus as a drumstick, where the thigh part of the drumstick or the upper part of the leg is the uterus, the bony part at the bottom is the cervix, and then on top of that drumstick, you have an arm coming out from each side. Those arms are the fallopian tubes. The fingers of the arm are fimbria, and those fimbria lie on or around the ovary. So when someone ovulates, the fingers grab that egg that comes out of the ovary, grabs it, and then there are tiny little hairs called cilia inside the arms that swoop and brush that egg into the uterus. The shoulder is where the fallopian tube attaches into the uterus. So anywhere along the length of the fingers all the way to the shoulder, if a pregnancy gets trapped there, that's an ectopic pregnancy that we specifically call a tubal pregnancy. Now, depending on where that pregnancy gets trapped, be it due to scar tissue or any kind of blockage, or even if the little cilia, the small hairs, don't work, so they don't swoosh that fertilized egg into the uterus, that fertilized egg will continue to grow, and then it will latch on around 4 to 5 days after fertilization. It'll latch on to wherever it happens to be located. If it's still sitting in the fallopian tube, it's going to latch onto the tube. The tube's not a viable organ for a full-term pregnancy. It's not going to work. It will eventually, usually sometime early in the first trimester to mid first trimester, will burst through its uh, location in the fallopian tube. That lady can potentially bleed to death. Now, everyone who gets pregnant in the fallopian tube. The ovary releases the egg, and if there's sperm in the area, it's going to fertilize that egg around where the rest is located, and then these little hairs will swoosh that fertilized egg into the uterus. If it gets trapped in the tube, it's a fallopian tube. If it falls out of the tube and it lands on the ovary, we call it not a tubal pregnancy, it's an ovarian pregnancy. If it falls out onto the bladder or onto the intestines or onto the fatty apron that covers the intestines, which is called the omentum, that's an abdominal pregnancy. It can even fall out onto the liver, and it's a hepatic pregnancy. If it actually makes it all the way into the uterus, but then for whatever reason it falls too low and it latches into the cervix, that's a cervical pregnancy. As a resident between 1993 and 1997, I was working at both NYU Hospital and I was also training at Bellevue Hospital. And at Bellevue Hospital, we saw a slew of ectopic pregnancies. I've seen every single one of those pregnancies except the hepatic or the liver pregnancy. I never saw a liver pregnancy. I just know about it from the medical journals and information. But once when I was a resident, we had a lady come in at 3 months pregnant. She came in with abdominal pain, discomfort, no bleeding, and we did the ultrasound. Everything looked perfect with the baby, perfect with the placenta. And then we noticed, after we monitored her, did a follow-up sonogram, it looked like the pregnancy was in the uterus, but it actually wasn't in the uterus. It was right next to the uterus. That's because it was a broad ligament pregnancy. So that fertilized egg had fallen out of the fallopian tube, and then it fell into the sleeve that connects the fallopian tube to the uterus. It's right between the tube and the body of the uterus. So it was in this triangle in between the two. Broad ligament pregnancy. We had to remove the pregnancy. That's going to be a life-threatening situation. I had also seen a woman who came in from another country. We'd never seen her before. She was 7 months pregnant. She was between 28, 29 weeks pregnant. Everything looked perfect with the baby, the placenta, everything looked normal. She came in for abdominal pain and she felt ill, sick to her stomach. We did the sonogram and then we realized the that 7 month pregnancy was not in the uterus. The baby was actually sitting on the uterus. The bag of water, the amniotic sac, was sitting on a small, non-pregnant appearing uterus, and that 7 month pregnancy was an abdominal pregnancy. The placenta had latched onto the omentum, so that fatty apron that lies on the intestine. We did surgery, took out the baby. The baby did well, and then the only issue was the complication with all of the intricate and vast blood supply that the placenta had garnered from the intestines, from the omentum. So that was the real complication for her pregnancy, but she ultimately did well. So as you can see, pregnancy can be very complicated. If it doesn't occur where it's supposed to be in the upper part of the uterus, it's a big, big deal. So most women will have some signs or symptoms. They'll either have abnormal pain, cramping, or bleeding. It's never normal to bleed during pregnancy. So if you have any unusual signs or symptoms like that, you'll always want to see the gynecologist and be evaluated as soon as possible to sort things out. That's why the best practice is if you find out you're pregnant, you do a home test that's positive, to come into the gynecologist as soon as possible, have your bloods tested. Once we know that pregnancy hormone number is at a high enough viable level where we should see a uterine and intrauterine pregnancy, a normal pregnancy in the uterus, which is viable around 6.5 weeks, then you'll want to have that sonogram done to confirm that everything is starting off normally. Um, Tomorrow I'll speak about the management and treatment of ectopic pregnancies. This is Dr. McDaniel at GYN Corner. Thank you very much for joining me. If you're in the tri-state area, the office here is Midtown Gynecology. You can check out our website. It's midtowngyn.com. And please come on by. We're in Midtown, west of the Empire State Building, just around the corner from Macy's, Penn Station, and Madison Square Garden. We're 2 blocks away from Madison Square Garden. We're 1 block away from Macy's and 1 block away from Penn Station. So come on by. Thanks again. And tomorrow's Saturday, so I'll be coming from the horse farm. Have a great Friday. Bye.